Good afternoon. We'll now start. It's already 2 o'clock. First of all, I'd like to welcome everybody to this pep talk this afternoon. And please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of your companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and at the end of the pep talk. Please show your face in the video when we have the group picture taking. As a reminder also, please take the online Learning Cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. The link is already in the chat box and also in the Viber group as well as in the Facebook group. This is the sample of the certificate that will be issued for those who pass the OLETE. Another reminder, 50 OLETE certificates entitle one mentee or participant to a voucher for ROJoson telemedical consultation. Another request that I'd like to make is that those who are not planning to take the OLETE, where I ask for a feedback to my pep talk, please type your feedback in the chat box during the open forum and before we part ways. Thank you. Let's now have a group picture taking before we start the pep talk proper. Okay. Okay, let's have a picture taking now. Okay, everybody is on 1, 2, 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. So these are seen in this diagram. Sample courses for health disorder, sample courses for health issue. So this may take 3 years or longer depending on the enthusiasm of the participants. My pep talk today is entitled Antibiotics, Use and Misuse. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of antibiotic use and misuse in their health management. The contents of this pep talk will be the following. What are antibiotics? What is misuse or use of antibiotics? What are germs? What are bacteria? What are examples of bacterial infections? How to recognize bacterial infections? What are the different classes of antibiotics? How do antibiotics control bacterial infections? What are the general objectives in prescribing antibiotics? How physicians decide on what antibiotics to prescribe for bacterial infections? How long do you take the antibiotics? What are the potential side effects? What is antibiotic resistance and its usual causes? And then lastly, what are my advocating statements and advice on antibiotic use and disuse? So let's now go to the first topic. What are antibiotics? Antibiotics are medicine, of course, and these are medicine that help stop infections caused by harmful bacteria. I repeat, harmful bacteria. Antibiotics, harmful bacteria. Misuse. What is misuse of antibiotics? Misuse of antibiotics means using them for the wrong purpose. okay, wrong reason, and in the wrong way, or in the wrong way, which pose greater risk than benefit. We usually balance benefit and risk. So this one will pose greater risk than the benefit to the health of the patients, as well as contributing to the development of antibiotic resistance, okay, which will eventually boils down to eventual ineffectiveness of the drugs. Okay, this is one area that we want to avoid also in the use of the antibiotics. In contrast, when you say use of antibiotics, it means using them for the right purpose, right reason, and or in the right way, which justifiably balance the benefit and risk, so more benefit and risk of treatment in the patients, as well as in avoiding development of antibiotic resistance. What are germs? What are bacteria? As mentioned, antibiotics are medicines that help stop infections caused by harmful bacteria. Bacteria is a kind of a germ. The word germ is a catch-all term that describes very small microorganisms like bacteria, viruses, fungi, and protozoa. So germs are everywhere. Most are harmless, fortunately, and even helpful, but some may cause disease, an infection, or the so-called infectious disease. So what are bacteria? Bacteria are microscopic, so very, very small cell, okay, single-celled organisms lacking a distinct nucleus, and these differentiated from the other types of germs. So this is bacteria, microscopic single-cell organism without a distinct nucleus. So they can have different shape, okay, spears, okay, rods, or spirals. Our bodies are home to an estimated 100 trillion good bacteria, many of which reside in our gut, in our gastrointestinal tract. Not only do we live in harmony with these beneficial bacteria, but they are actually essential to our survival. They contribute to digestion, produce vitamin K, promote development of the immune system, and detoxify harmful chemicals. To help you understand or remember that germs are not all harmful, think of the microbes that contribute to making many foods that we enjoy nowadays, such as bread, cheese, and wine. So remember these statements on the good bacteria. Okay, there are a lot of harmless bacteria in our body. So when we talk about the risk of taking antibiotics, especially in misusing them. So the antibiotics, if not used properly, can affect the normal bacteria in our body. Again, antibiotics are medicines that help stop infections caused by harmful bacteria. There are right medicines or correct medicines for the different types of germ infections. For bacteria, we usually use antibiotics. For viruses, we use antivirus drugs. For fungi, antifungal drugs. And then for the protozoan infection, we use antiprotozoal drugs. But in some of the protozoal drugs can be used to treat bacterial infection. Example, metronidazole. Metronidazole is actually a antiprotozoal drugs, but it can be used to treat bacterial infection in some cases. So remember, antibiotics are used for bacterial infection only, and not for infection caused by viruses, fungi, and protozoa. Examples of bacterial infections, you have pneumonia, although most of the time it's caused by bacteria, but sometimes you can have viral pneumonia. So the pathogen here, the microorganism is Klebsiella pneumoniae, the common pathogens that cause pneumonia. Of course, you have Mycobacterium tuberculosis, the bacteria that causes tuberculosis, Clostridium tetani that causes tetanus, Vibrio cholerae, cholera, okay, and then you have the Neisseria, gonorrhea causing gonorrhea, then syphilis, Treponema pallidum, then Leptospira for the leptospirosis. Okay. So these are examples of bacterial infection. Examples of viral infections. Okay, so we're very much aware of the COVID-19, which is a viral infection, and then also the flu is also another viral infection affecting the upper respiratory tract. Okay. Examples of fungal infections are the ringworms and the athlete foods. Okay. And then examples of protozoal infections would be the malaria and the amoebiasis. Okay. How to recognize and diagnose and differentiate the different types of infections, the bacterial, viral, protozoan, and fungal infections. So the first thing to do is to use pattern recognition based on the signs and symptoms of the patients. And then if there are several diseases that would cause same signs and symptoms, then you use the prevalent process, which is the more common in the community now. Okay, that's frequency. That is when meant by frequency. You use two processes: pattern recognition and prevalent process. Then, of course, the recognition and diagnosis of the different types of infections will rely heavily on the doctors that you have consulted. Okay, then sometimes the doctors can also use diagnostic tests to validate their suspicion. Again, let me repeat, antibiotics are used for bacterial infections only, and not for infections caused by viruses, fungi, and protozoa. Now let's go to the different classes of antibiotics. There are many, as more than 10. This is just a partial list. So you have penicillin, macrolides, cephalosporin, fluoroquinolones, beta-lactams, tetracyclines, trimethoprim sulfamethoxazole, lincosamide, urinary anti-infectives, and others. So some antibiotic classes work by killing bacteria. Okay, that's one way of controlling the bacteria. They kill the bacteria. Okay. The others work by preventing the ability of the bacteria to multiply. Okay, through the following means. So the antibiotics attack the wall or coating surrounding the bacteria. They interfere with the bacterial reproduction. And then the other one is by blocking protein production in bacteria. So this is aside from directly killing the bacteria. Antibiotics can be categorized by their spectrum of activity. Okay. So whether they are narrow, broad, or extended spectrum agents, whether they are best against gram-positive or gram-negative or both, and whether they are effective against anaerobes, aerobes, or both. Okay. So note here there are different types of bacteria based on staining. So you have the so-called gram-positive, which usually appear blue on stain, and then gram-negative usually appear red. Okay. So this distinguishes them from gram-positive and gram-negative bacteria. And then there are two types of bacteria, whether they require oxygen. Anaerobes, they require oxygen to survive. Anaerobes, they don't require oxygen. Okay. Narrow spectrum antibiotics can only kill or inhibit limited species of bacteria. Medyo confined siya, medyo limited lang siya. Okay. So example is penicillin G, which affects primarily only gram-positive bacteria, hindi mga gram-negative. Okay. Broad spectrum antibiotics can kill or inhibit a wide range of microorganisms. Example would be azithromycin and clarithromycin. So marami siyang pinapatay, no? Broad spectrum. No? Extended spectrum antibiotics, as mentioned, extended from the broad spectrum. Okay, mas malawak ang kanyang coverage. Okay, so it can kill and inhibit gram-positive, practically all gram-positive and some gram-negative bacteria. Okay, so example are carbenicillin, mecloxylin, piperacillin, tricarcillin. So these are usually used in hospital setting because there are a lot of bacteria in the hospital. What are the general objectives in prescribing antibiotics? There are two general objectives. One is therapeutic. The other one is prophylactic. Therapeutic in the sense that you treat the bacterial infections when it has already set in. So, igagamot na lang. Prophylactic means to prevent the onset of bacterial infections in situations where risk is high. Example, these are some of the examples wherein we use prophylactic antibiotics. Surgical prophylaxis, we give antibiotics to prevent wound infection after surgery. Okay. And then leptospirosis prophylaxis, you've heard of that. We usually give doxycycline to prevent the appearance of symptoms of leptospirosis or infection of leptospirosis, especially during the flood situations in the country. How physicians decide on what antibiotics to prescribe for bacterial infections? Okay. So the first thing to do is start with diagnosis of bacterial infection. Diagnosis palagi ang pinaka-importante. Okay. Then from the experience or the lab results kung meron, determine the usual bacteria that are causing the infection. So this could be based on the experience of the doctor, okay, and then or if there are lab results that show that gives information, then the usual bacteria, the bacteria that's causing the infection will be identified. Then the other question is that you have to decide is the infection mild, moderate, or severe? Because this will dictate the type of treatment that you will give also. Okay. Then lastly, decide whether to give a narrow, broad, or extended broad spectrum based on the information that you acquire above. And then you compare, because there are a lot of antibiotics, then you compare the benefit, risk, cost, availability of the different antibiotic options. Okay, so basically you decide whether you want to give an oral antibiotics, parenteral, meaning yung mga suero or intramuscular, or topical, yung pinapahid lang, or whether the treatment should be done inpatient or outpatient. So this is, in general, this is how physicians decide on what antibiotics to prescribe. So the general recommendations will be, as much as possible, narrow spectrum antibiotics are used when specific causative bacterial agents are known to be the usual culprit, or based on experience, okay, or if these are determined by the lab test. Okay. Narrow spectrum antibiotics kill or inhibit only those bacteria species that are unwanted, that is present in the particular patient causing the disease. As such, they leave most of the, if you give narrow spectrum antibiotics, they leave most of the beneficial, the harmless bacteria unaffected, hence minimizing the collateral damage on the microbiodata. So microbiodata means these are the beneficial or harmless bacteria present in our body, and there is a low propensity for bacterial resistance development. Examples of narrow spectrum antibiotics will be penicillin and amoxicillin. The second recommendation is to use broader spectrum antibiotics only when needed, such as when the harmful bacteria, if the physicians know that the harmful bacteria are multiple, such as there's a combination of gram-positive and gram-negative, then the physician is justified to use a broader spectrum. Another recommendation is using a broader spectrum antibiotics when only a narrow spectrum antibiotics are needed. Otherwise, it may cause damage to normal bacterial flora and antibiotic resistance. So give it only as needed because we're afraid of causing antibiotic resistance. Examples of broad spectrum antibiotics will be co-amoxiclav and azithromycin. The other recommendation, okay, this time it's whether to use topical or oral antibiotics for skin lesions. So there is no need for topical antibiotics for minor skin and soft tissue wound and infections. As we know, these are commonly done by our people in the community. Okay. Usually antibiotics are not needed Even oral, for minor wounds, just cleaning with soap and water will do. Okay. Now, for moderate and severe wound infection, oral or at times parenteral antibiotics are preferred. So kung medyo moderate na and severe, then you can use antibiotics. Then there's a choice between oral and parenteral antibiotics. Using topical antibiotics commonly lead to antibiotic resistance and allergy. That's the main reason why topical antibiotics is not really prepared, okay, as compared to oral antibiotics. There are usually many options in the selection of antibiotics. As I said, there are a lot of antibiotics in the market. Okay? The physician is just to use the BRCA, benefit, risk, cost, availability, analysis in the selection of the most cost-effective antibiotics. Okay? So the physicians will have to input the cost also. Nowadays, there are a lot, antibiotics are not cheap. They're very expensive. How long should a course of antibiotic treatment? Okay, this is a common question, common issue. The traditional recommendations is at least 7 days, and some would extend it to 14 days for all antibiotics to avoid antibiotic resistance. This is the main reason why the long duration, to avoid antibiotic resistance, to make sure that all the bacteria are dead before stopping the drugs. Okay. Nowadays, however, the recommendations on duration has become shorter, as studies have shown, maybe as short as 3 days to 5 days, but it all depends on the type and severity of the bacterial infection. The duration can still reach 7 to 14 days depending on the situation, the severity, okay, and then whether it's the patient is improving or not. Okay. My personal recommendations will be this way. Okay, take for at least 3 days initially and observe. So if you're prescribed with antibiotics, you take it for 3 days and then observe. If the infection is subsiding, okay, then you can add 2 to 3 more days and observe. When you say subsiding, it is not completely resolved. Okay, so you continue on. After complete subsidence, nawala na, then you can add 2 to 3 more days to make sure that hindi na babalik. Okay, so if no recurrence occurs, then stop the antibiotics already. Okay. Now, if after 3 days, as I said, initially you give it for 3 days, then observe. If there is no response, then change antibiotics. Okay, so this particular recommendations is impact also on the expenses a patient is usually incur when they buy a lot of antibiotics, good for 7 days, 10 days, just to be changed after 3 days by the physician. Sayang lang. Okay. What are the potential side effects of antibiotics? Common side effects will be nausea, vomiting, abdominal discomfort, and then diarrhea. These are the more common ones. There are more. Some may develop allergy and toxic effect. The toxic effect is the most dangerous one. Antibiotic-associated diarrhea is most common, among the most common adverse or side effects related to antibiotic use. Most cases are mild naman, but Clostridium difficile infection causes a spectrum of disease. This is one type of situation that we have to be aware of because it can, aside from the diarrhea, it can cause colitis, toxic megacolon, and eventually death or potentially death. Okay, it can cause death. Okay. Fortunately, it's not very common. So why do antibiotics cause this particular problem? Okay, Clostridium difficile. Okay, because when you take antibiotics, it also kills the good bacteria, and it allows the Clostridium difficile to multiply and release toxins that damage the cells lining. Okay, the intestinal wall, causing diarrhea, abdominal pain, fever, as well as other symptoms. Okay, so this is one worst scenario in taking antibiotics unnecessarily. The others will be the more milder one will be it will just cause antibiotic resistance or no effect at all. no response to the antibiotics. Now, what is antibiotic resistance? Before the advent of high frequency of antibiotic resistance, antibiotics are powerful medications that work very well for control of bacterial infection. However, some antibiotics are now ngayon less useful than they once were due to an increase in antibiotic resistance. Antibiotic resistance occurs when bacteria can no longer be controlled or killed by certain antibiotics. Nag-resist na siya, ayaw na tumalab. In some cases, this can mean there are no more effective treatment for certain conditions. So as we know that it's hard to produce mga drugs, antibiotics. So there might come a time that we don't have any more antibiotics to be used to treat our patients with bacterial infections. Okay, so there might be an increase in loss of lives because of the uncontrolled infection. So when you take an antibiotics, the sensitive bacteria are eliminated, even those which are beneficial, which are not harmful. So the bacteria that survive during an antibiotic treatment are often resistant to that antibiotics, especially if not treated properly. And these bacteria typically have a unique characteristics that prevent the antibiotics from working against them. So in other words, in Tagalog terms, hindi na tumatalaw. Antibiotic resistance, what are the causes? Okay, basically, it's caused by misuse of antibiotics, not only by patients, but also by physicians. A lot of physicians are also prescribing antibiotics left and right. That's why there's now a movement on controlling, educating the physicians on the proper use of antibiotics. My advocating statements and advice on the antibiotics use and misuse. Number one is to promote correct use of antibiotics on yourself and on other people, your relatives, to maximize their benefits, prevention and treatment of bacterial infections. Number two, to prevent unneeded side effects and toxic effects of antibiotics. And number three, to prevent antibiotic resistance. Avoid misuse of antibiotics on yourself and on other people. Avoid the wrong use, particularly on using them for viral infection, which is rampant up to now. Avoid topical antibiotics if not indicated. Avoid too short or too long a time of antibiotics, which is a common cause of antibiotic resistance. So, summary and takeaway, I have discussed all of these topics. Okay. I won't repeat them anymore. Just take a look. And then takeaway in relation to patient empowerment, be always in touch with reliable medical information on antibiotics use and misuse. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan, to gain greater control over decisions in medical management of oneself and your relatives by knowing the basic principles and processes of use and misuse of antibiotics in their health management. So this ends my pep talk. I hope I have empowered you to have a better understanding of antibiotic use and misuse in your health management. Before we go to the QA, reminder, Olete, okay, and then certificates, 50 certificates, Olete certificates, 1 voucher, and then request, please put your feedback in the chat box. Okay, if you're not going to take the Olete, okay, to give me feedback. And then let's now have the group picture taking. Okay, 1, 2, 1, 2, 3. Okay. Okay, the floor is now open for questions, comments, consultation. Okay, anything that you want to share with us here. Okay.
Doc, this is
Yes,
Susan.
Susan.
Yes, Doc.
Go ahead, Susan.
Uh, I don't know. I was late by a few minutes, but I don't know if you took up the composition of antibiotics. If not, I'd like to ask, uh, are antibiotics purely composed of chemicals? If not, hindi ba pwedeng yung galing din sila sa mga, ano ba, yung natural, yung mga dahon or something?
Yeah, there's a combination. Nowadays, usually hindi siya from the natural. Yung penicillin, I think, came from molds, no? Okay. Yung mga molds, no? Okay. And then the others are usually concocted from chemicals, no?
Okay.
So may combination, but nowadays wala na yung mga natural sources until somebody will discover it. No? Ngayon, they always use yung mga chemicals na. No? Okay. And it's hard to develop a drugs based on chemicals. It have to undergo a lot of studies, no? Expensive, no? Okay. So that's why it's important to talk about antibiotic resistance, to avoid antibiotic resistance. Kasi mawawala na tayo ng mga antibiotics. No? Okay. Any more?
Doc, meron po sa chat box na sharing from Jocelyn T.
Okay.
Sabi, just to share with the group, years back, my toenail was removed by Dr. Hoson. Debridement of the skin was done because of fungus. Doc did not prescribe oral or topical antibiotic. I was advised to only use soap and water.
Oh, did it heal?
Yes, Doc. Effective.
I mean, it healed without the use of antibiotics. Okay.
Yes, Doc.
Okay. So ingrown toenails actually a bacterial infection. Most of the time, it's not, hindi siya fungus, no? Okay, it's usually a bacterial infection because the nail impinges on the side of the fleshy part of the toe, and then it causes some infection, no? Okay. So the way to manage it, now there's an infection there, is to debride it. Okay, so remove the cause. The nail is the one causing it. So we remove the cause, and then after that, we let it heal by itself. No? Okay. Usually, open wound is better than always keeping it closed and then not cleaning it. No? Okay.
Yes,
so
Doc.
you clean it with soap and water 2 to 3 times a day. No? Okay. So thank you for sharing that. So that's an illustration of the use and misuse of antibiotics, because I think there are a lot of surgeons, a lot of physicians are prescribing antibiotics after the operations. No?
Yes, Doc.
Before the operations, baka pwede. Pero usually, pag may ingrown toenail, hindi gumagaling if you don't remove the part of the nail. No? So keep on prescribing antibiotics, hindi gumagaling. No? I suppose most of you have experienced a lot of patients have experienced that may ingrown toenail, no, antibiotics ay gumaling, no. Then after na tinanggal yung ingrown toenail, gumaling na kagad, no. Okay.
Healing was lampas a month. Matagal yung healing, Doc.
Yeah, sa toes talaga mahirap talaga. Usually 1 month naman talaga yung mga sugat eh, no. Okay na yun, no. Okay. Because you have a wound there, di ba? Part of your nail was removed. Tama? Okay.
Tama po.
Then you have a raw area there that will slowly, magkakaroon siya ng coverage of skin. No? So that will take usually 1 month talaga. No? But you can walk right after.
Yes.
Okay. Any more?
Pwede ulit, Doc.
Sure.
My experience, no? I don't know if I took it up here earlier, but I think 2 months ago, there was some sort of well, sebaceous cyst, sabi nung derma, no? So binigyan niya ako ng antibiotic para yung redness mawala. It was located below my breast but near my waist, no? And then sabi niya, pakita ko raw sa surgeon, baka gusto niyang tanggalin, no? So pumunta ako sa surgeon dito sa Makati rin, sa Proventus. He was about to remove it. Kaya lang ang mahal, no? Well, anyway, pumayag ako para lang matanggal. Eh nung tumaas yung blood pressure ko, hindi siya, sabi niya, i-postpone na lang natin. Postpone, okay. Tapos, after that, I wasn't able to see him anymore dahil nagbakasyon. So, I went to yung regular doctor dyan din sa sa HMI. Ang sabi niya sa akin, tinignan niya, sabi niya, hindi na namumula nag-antibiotic. Binigyan ako, sabi ko pag yan huwag mo nang masyadong pansinin yan. Para lang yan tigyawat sa face, sabi ng pag yan. So ngayon, it's still there. Wala naman siyang nana, nag-flatten ng konti. So I just leave it there. Is okay ba yon?
Okay. Yes and no. Okay. Okay. Okay, let's start with it's epidermal cyst. I assume that's the correct diagnosis. May mata ba siya? May mata? May puto?
Wala na po.
Pero dati may mata.
Oo.
So it has been there for a long time. Matagal na yan. di ba?
2 months na po.
Okay. Kasi we always start with the diagnosis. What is it? No? Okay.
Mm.
Whether it's really epidermal cyst or something else. No? Let's assume it's
Yes.
epidermal cyst. Let's assume kasi hindi ko nakikita, no? So epidermal
Yeah.
cyst, no? How big is the cyst?
Maliit lang actually eh. Baka hindi ko na maano. Can I show you my ito lang kasing ba to?
1 centavo coin? 1
centavo. Baka. Yeah, similar to that. Parang 1 centavo or less. Oo.
So maliit lang, okay? So
Oh.
maliit kasi the size also determines the decision, no? No?
Oo.
And then the decision to operate or not, no? Okay.
Yes.
And yung mapula kasi yung epidermal cyst can get infected, because
Okay.
epidermal cyst just means yung mga retain mga dead skin, no, that
Okay.
form into a cyst, no? Kung hindi siya lumalabas, no, through that hole, no, ipon siya, then it might get infected, no? Okay. So if you get infected, ang sign of infection will be redness. Di ba? Mapula, and then kung minsan may nana, na, ganon, no? Okay.
Yeah.
So then, tinatanong mo sa akin kung maliit lang siya, okay.
Walang nana.
Walang nana, okay. So kung may mapula-pula, you cannot really operate on it yet kasi pag inoperan mo, you want to have the best result, no? Okay.
Yeah.
So if you operate on epidermal cyst, if somebody decide to operate on epidermal cyst, the whole balot, yung whole thing must be removed. Yung capsule, no? May balot yan no? Okay. So kung may infection siya, dikit-dikit yun sa wall, hindi madaling tanggalin, no? So most of the time, surgeons would give antibiotics first para mag-subside muna yung infection, no, before operating, no? Okay. But a lot of times, no, while giving the antibiotics, ayaw mag-subside. It keeps on getting worse. Okay. So sometimes the doctors will just put an opening doon sa may butas, no? Lakihan lang yung butas, palabasin na. Okay? So yung sa iba, may butas ba?
Wala.
Wala. Baka hindi epidermal cyst. Baka hindi no?
Hindi ko nga alam eh.
Yung
Sabi
epidermal
nung-
cyst kasi may mata Kung may mata, bubuksan lang yan, no? Lakihan lang, then palabasin lang yung mga puti, yung mga nana, gano'n, no? Pag lumit na siya, as mentioned, parang whiteheads yan, di ba? Ganon. Pag
Yung nga,
lumit
yun ang sabi nung isang doktor eh, parang whitehead. Oh.
kaya nga, kung lumit siya, you can just leave it alone for a while, then just observe. No? Kung if it's not bothering you, no, then you don't have to have it removed. No? Kung maliit lang. No?
Oo.
Okay?
Sabi ng doktor kasi na latest yung ano nagtingin na ano, sabi niya para lang daw yan tigyawat sa mukha.
So I assume maliit siya.
Yeah.
Okay.
So leave it at that muna.
Yeah. Just
Okay.
keep, if it's, kung may mga opening, keep on pressing it. Palabasin mo lang. Parang whiteheads, palabasin mo lang. Yung mga laman. No?
Okay, sige.
Okay.
Thank you.
Okay. Any more questions?
Dok, meron lang ako tatanong.
Sure.
I just would like to know, what is the difference between branded and generic antibiotics?
Branded and generic.
Kasi pag pumunta ka sa butika, tinatanong nila doktor kung branded ba or generic. Kasi yung mahal yung branded, doktor eh. Ano ba ang pagkakaiba sa contents ba? Sa nilalaman?
Halos pareho lang. Pero okay, number one, let's put it this way. May misnomer dyan eh. Kasi because of the usage of mga tao natin, yung mga Pilipino, no? Saka ano, when you say the two types of drugs, dalawa yan, yung tinatawag na original drug. Yung original, yung innovative, no? Yun ang that went through a lot of tests, mahal, ano yan eh, kaya it's very expensive, di ba? Saka may copyright yun eh, di ba? So after 5-15 years, na wala ng copyright, no, ganon, anybody can imitate it already, na? Can produce already. Kaya yun ang mga generic, yung kaya tawag na generic, na? Okay? So let's just put it innovative, yung original drug, and then the generic, di ba? Okay, they have the same composition naman eh, no? Yung pinaka main chemical name, no? Okay. No. I'll give you an example later on. Yung chemical name pareho lang, pero yung generic din, yung generic has brand. Kasi it has to have a name, manufactured by whom. Kaya may name pa rin yun, di ba? So in a way, it also has a brand, no? Okay, so what you have to distinguish whether it's the original innovative drug or the yung mga we call it generic na, and the generic na parang inimitate lang, no? Okay, from the ano, kaya mas mura yung mga generic kasi it pass through yung mga licenses, yung mga research procedures, no? Malaking ginastos kasi yun yung original nag-manufacture doon, no? So they have to put up a price, no? A high price for that. No? So example, ano ba yung example nito? So, let's talk about antibiotics, no? Example will be co-amoxiclav, no? I don't know kung ano yung innovative yun. Augmentin. Okay? Augmentin is a brand. Di ba? Okay? May pangalan siya, Augmentin. Yan ang pinaka-popular noon. No? Up to now, it's very popular, but it's probably very expensive. No? Then after that, may generic. No? Okay? So when you say generic, meron siyang the same, ang content ng Augmentin is co-amoxiclav something, na co-amoxiclav, na okay. Yung generic co-amoxiclav din, pero may pangalan siya, na may commercial name kasi it has yung manufacturer doon magbibigay ng isang pangalan, na so you need may mga RightMed has a di ba, co-amoxiclav na version, di ba? RightMed, ano pa, may mga pang mga ibang gamot na yung iba talagang co-amoxiclav lang, USP, something like that, na okay. So in short, pare-pare lang siya, na when they ask you basta ang pinaka-safest ngayon to be practical, if the botika asks you branded or generic, sabihin mo lang generic na lang. Trust in generic.
Parang ano Parang
Trusted.
parang ang notion ko, parang mas nakakagamot yung branded kasi nga mahal. Oo,
Hindi.
kaysa doon sa compared
Pareho
to
lang yan. Pareho lang
generic.
yan. Pareho lang
Pareho
yan.
lang.
Pareho lang yan. Na? Okay. So I have lectured that during the first part of my pep talk, di ba? The use of
Okay.
drugs, generic versus yung mga commercial, yung original. So use generic.
Okay, doctor. Thank you.
So lahat naman gamot, it's always on the trial basis. Lahat, essentially. No? So you can try the generic one first. Kung di mo bra itong isa, then you go to the next higher. No? Okay. Okay.
Mm.
Okay. Any more questions? Well, okay. May tanong si Jocelyn T, no? Okay. Will taking probiotic really help to increase the good bacteria in our body? Is Protexin balance a good one? Ano yung Protexin? I'm sorry, I'm not familiar with Protexin. It's a commercial name for the probiotic, Protexin. Jocelyn? Ano yung Protexin?
It's a probiotic.
Yeah nga, it's a commercial, it's a brand. Okay, tama?
I don't know kung brand o given by the gastro.
Yeah, it's a name. It's a name of a drug, no? Protexin, no? Okay. So, sa akin, personally, of course, yung mga minamarket, ina-advertise, no? Palagi sabihin, may advantage, no? They have to sell, di ba? Okay. But in reality, if you just take healthy diet, practice healthy lifestyle, healthy diet, you practically don't need all those things. No? Okay. Ako, I have not taken probiotics up to now. Okay. I'm already 73, going 74. No? Okay. So I just rely on natural things. No? Okay. Healthy diet, basta balance lang, okay, moderate in amount, lahat, na? Okay.
Thank you, Doc.
Okay. Any more? So take note of the misuse of antibiotics. Okay. Number one, we emphasize why the big fuss about the so-called misuse, because we want to avoid antibiotic resistance, no? Kasi mauubos na yung mga antibiotics natin available, no, to treat infections, no? So number two, when you use antibiotics, no, try to you have to ask your doctors for kung merong alternative. You can talk to your doctors, because most of the doctors, they prescribe drugs that might be peddled to them by the mga drug companies, no? Okay. To the point baka medyo mahal, no? But baka pwede pa yung iba, yung cheaper ones, no? Okay. Or as we were talking, generic might be as good as the so-called branded, as the innovative drugs, no? So you have to factor in the cost also, no? Okay. So BRCA, benefit risk cost availability analysis pa rin, no? Okay. So if there's no need for your topical antibiotics, wag na kayo bumili ng topical antibiotics. My suggestion. How many of you have topical antibiotics at home?
Ay, mga topical.
Ano yung brand anong meron ka?
Meron.
Ano yung brand na meron ka?
Yung
Neosporin.
Neosporin, ano pa? Meron pang ibang brand dyan, di ba? Yung pinapahid, na?
Yes.
Fusidin, Doc.
Neosporin.
Fusidin.
Fusidin. Yeah. Ano
Yes.
pa? Meron pang M. Start with an M, no? Ganun. So kung I don't think it's really needed kung minor infection, wound lang, yung sugat, no? Wag na lang nilagyan ng antibiotics. Just wash it with soap and water, no? Parang yung sugat ni Jocelyn yung sa paa, di ba? After an operation, may sugat yun, di ba? So we just wash it with soap and water. It will heal, no? Okay. So don't buy the topical antibiotics anymore, no? Mahal din yun, ha? Topical antibiotics is not cheap, no? And then it will just cause antibiotic resistance, no? Okay. Ano pa? Okay, of course, don't take antibiotics for flu, for viral infection. Yan ang even during the COVID-19, yan ang ina-emphasize, di ba? Na don't take useless yung antibiotics, di ba? So ang ginagamit sa flu, COVID will be those antiviral drugs. Mahal lang. No? Okay. Okay. Any more?
Doc, may I ask again?
Sure.
Yes, Doc. Antibiotics should only be prescribed. We don't take it without doctor's prescription, right?
Correct.
Kasi when I was younger, well, I had the same symptoms, parehong sakit, nagtipid. Sabi ko, ito yata yung binigay ni Doc noon or something. Mabuti na lang, sa pharmacy, ayaw nilang pagbili yun because I had no doctor's prescription.
Yeah, okay. So, I don't know. Mukhang lahat ng antibiotics should have a doctor's prescription. No? Okay. And then, dapat yung mga drugstore should not be dispensing them kung walang prescription. Pero I think there might be some, kung may kakilala ka, bibigyan ka. Di ba? Okay. Kahit na walang prescription. No? Okay. Okay, the other one is, the other reason related, yung mga natitiran yung gamot, na kasi yan ang one of the recommendation na to avoid antibiotic resistance, kasi hindi nyo naubos yung, let's say, nireseta kayo ng 7 days, hindi nyo naubos yung 7 days, may natira, next time, karoon na konting symptoms, so ito na, inumin ko na ito, no? Ganon. No? So kulang ang dosage, no? Nag-self-prescribe na kayo, kulang ang dosage. So that's the cause of the antibiotic resistance, no? Yeah, sinasabi nila, they use the word, don't take the leftover drugs. No? If you look at the internet, they will just, the advice is, don't take the leftover drugs. Ibig sabihin, ubusin mo na, o itapon mo na. No? Okay? So because there's a clamor to help in the fight against antibiotic resistance, kaya they came out with that advice. Don't take the leftover drugs. Sa akin, okay lang may leftover as long as you know how to use it. Di ba? Okay. And then kaya ang aking practice ngayon, I think I started it about 10 years ago. When I prescribe antibiotics, although if I know it's good for 7 days, so 3 times a day times 7, 21. No? Okay, 21 ang total number that you might need to take. No? But I always advise the patients, buy for 3 days only muna. Okay? Okay, para hindi masayang. Diba? Buy for 3 days and then you observe mo and then follow up with me, no, or call me. Kung lumiliit, nagre-respond, then you continue. You buy another 3 days. No? Okay. Kasi kung binili mo in 21 days, kung after 3 days, no response, no, hindi siya gumaling, no, so sayang na, di ba? Sayang yung natitirang gamot, no? Mahirap na isole, di ba? Okay. So yan ang style ko when I prescribe medicine. I usually ask the patient, buy only good for 3 days muna, and then to check kung may response, to check kung may allergy, gano'n, no? And then kung wala at kung nagre-respond, then you add 3 more days, gano'n. So usually by 3 ako. 333, ganon. Hanggang mawala. Na? Okay. Okay. Ang kapalit lang naman yan, yung babalik-balik ka ng butika. Okay. Okay.
Doc,
Anyone?
question.
Sure. Sino si Perla, si Melly? Melly.
Nelly.
Ah,
Kasi yung ibang doktor hindi naman sasabihin you buy only 3. So let's say you buy for the 7 days.
Oh.
Tapos pag 3 days walang usually ba doc 3 days dapat may effect na.
in general, we use 3 days as ano.
Kasi minsan yung doktor pa sa mo, doc wala naman, di naman lumiliit. Let's say may bukol or something or ano. Sabi niya, finish mo yung yung 7 days.
Tama.
Iba kasi sasabihin gano'n eh. Hindi mo pa kasi natapos yung na 7 days. Gano'n, ubusin mo muna. Tapos, kasi yung nangyari sa akin, inubos ko yung 7 days, wala pa rin nangyari. So, sabi niya, okay, I'll prescribe another antibiotic for you. So, nakatatlong antibiotic ako. Sa huli, nagsawa na ako. Sabi ko, puro antibiotic na iniinom ko. Hindi na ako uminom, ini-stop ko na.
Okay.
Parang dinasalan ko na lang yata, binuhusan ko ng holy water. Tapos nung huli, sabi hindi siya nag-subside.
Okay.
Ganun na nangyari sa akin. Kasi hindi naman doc sinasabi 3 days. Hindi mo pa naubos eh. Ubusin mo yung 7 days. Siyempre walang effect yan. Gaganon sila doc. Anong gagawin mo? Paano ka babalik? Talaga bang kailangan ubusin yung 7 days doc?
Yan nga. Okay. That's the purpose of our pep talk dito, no? The pep talk here is to enlighten you, to empower you, no? Okay. So, but remember, these are all my personal opinion. I call this from my personal experience, practice, no? Okay. So yung practice ko, okay, might be different from the practice of other doctors, and they might disagree, no? They might disagree, no? So, but if you think there's a sense to what I'm saying, okay, you might pick it up, okay? So, or you can tell your doc, if bigay ka ng 7 days prescription, pili mo like, ikaw magbabayad sa butika, hindi mo siya, di ba? So, pagbili mo, you just buy 3 days muna, di ba? Ngayon, kung after 3 days, sabi mo sa doctors, Doc, hindi pag gumaling after 3 days, kung sinabi niyang tuloy mo 7 days, ako magduda ka na kasi she might be, the doctors is trained to, kasi parang dekahon na sila eh. Sabi niya, it must be taken for 7 days. It must be taken for 7 days. Ganun. Yung mga perception ng maraming doctor yan. This was how I was trained before. No? Okay. So basta 7 days ng 7 days, tuloy-tuloy lang. No? Okay. So nowadays, I don't do it anymore. I just to be more rational, yun nga, i-observe mo na, and then to help the patient and their finances, cost, no? Huwag mong bibilin lahat, no? Okay. Ano. So,
ngayon, ganyan na ginagawa ako, 3 days muna.
yeah, in general, that's accepted yan, yung rules niya, no? Kasi when we give, kahit na yung mga severe infections sa hospital, now, when we try out antibiotics, kung hindi gumagana within 3 days, no, palitan na namin, di ba? Papalitan na namin, no? Yung outpatient mahirap palitan kasi papalik-balik kayo sa doktor, di ba? Okay, but if there's kung may mga conscientious mga doctor who can advise you properly, no? Okay, mas maganda, di ba?
Kasi Dok, hindi kanya ipe-prescribe ng gamot pag hindi mo naubo. Ang gagawin ko, Dok, bibila akong 3, pag walang effect, after 7 days, babalik ako. Pero hindi ko na uubusin yung 7 days. Dok, walang effect. Bigyan niya ulit ako panibagong antibiotic. Pwede ba yun?
Ewan ko, baka malaman niya.
Hindi, after 7 days na ako babalik. Kasi naka 7 days na ako, sasabihin ko, wala namang effect. Hindi naman niya ako, Dok, bibigyan na another antibiotic pag hindi ko natapos yung 7 days.
Now, the best way to tell them na convince them na 3 days na ho, Doc, wala pang effect, no? Kasi baka if you wait for 7 days, baka lumala naman. Wawa ka naman.
Bagay, oo.
Okay.
Thank you, Doc.
Okay.
Doc, so another,
Sure.
do we need to take how many glasses of water when drink how many glasses of water in taking antibiotics? And second, do antibiotics affect our kidney?
Yeah, yung lahat ng gamot can affect your kidney, can affect your liver, no? Kasi that's where the yung mga metabolites pass through, no? Kidney or liver, no? Okay. Now yung basta lahat ng gamot may potential side effects sa lahat ng major organs, no? Sometimes even the heart, di ba? Meron diyan, no? Ganon. No. So, in answer to your question, tubig, wala, konti lang tubig inumin mo para malunok mo lang. You don't have to drink a lot of water just to to flush it out.
Yes, to flush it out immediately.
Okay, you want to flush it out, yung anong gusto mo.
Yeah.
Mahirap yata I'm not aware of that, basta yung paglunok mo lang, you take in 1 glass or half glass, di ba? Malulunok mo na yon, no?
Yeah, half
Now,
glass. So,
kung how many, ang tanong mo, you want to flush it out?
because it might affect the kidney nga, baka magtagal doon.
Sa ngayon, wala akong kasi it will, yung may mga half-life din doon no? Usually, it will stay there for a longer time, not just 1 day, 2 days, di ba? Okay. So, you just drink any amount of water. Kung gusto mong marami, mas maganda, wag naman, just because of that reason, if a flush out mo, you take a lot of water.
Yeah. Kasi,
Okay. Okay lang sa akin. No problem. I don't, you want to, if that's your thinking, line of thinking, okay lang, no? Okay, but whether it works or not, I don't know. No?
sige, okay. Thank you.
Okay, basta katamtaman lang na maraming tubig. Huwag naman sobrang marami, na. Okay. Okay. Any more?
Doctor,
Doc, you mentioned about allergy as side effect.
Yeah.
Sa po to. You mentioned about isa sa mga side effect ng antibiotic, allergy. Na-experience po ito ng husband ko 3 decades ago. Grabe ho pala ang effect sa allergy kasi nagka-anaphylactic shock siya.
Yeah. Okay.
Tinurukan siya ng antibiotic.
Antihistamine.
Hindi ko matandaan kung anong klaseng antibiotics.
Injectable antibiotics pinigay sa kanya.
Injectable ho. Injectable.
Okay.
Sa hospital po nangyari ito.
Yeah. Yeah. May mga potential side effects yun.
Isa sa mga leading hospital sa Manila.
Yeah.
Neighbor ng neighbor ng Manila doctors.
Okay. So, we go back to the basic principle. Lahat ng gamot, lahat ng pagkain, even pagkain, will potential side effect. Pagkain can cause allergy, di ba? Okay. So, that's why we have to be on the lookout. We have to be on the lookout. Kung isang drug...
allergy ka sa antibiotics na ito. Whether oral and injectable.
Pwedeng mangyari din sa oral, no? Kasi pwede mangyari din sa oral na antibiotics. Even topical, meron din, no? In topical, yung pinapahid, kaka-allergy din yon, no? Okay. So depende sa makeup ng katawan ng tao, no? Kung minsan prone to allergy sila, mag-allergy sila, no? Okay. Parang asthma, some people will be prone to asthma, some people are not, no? Okay. So as just take note of those potential side effects. Kung it's not needed, don't take it, di ba? Don't risk it, di ba? Okay. Okay.
Thank you, Doc.
You're welcome.
Doktor, tatanong ko lang,
Ah,
yun po bang amoxicillin is obsolete na ba yun na antibiotic?
hindi pa, meron pa dyan. Kaya lang, kaya nga sabi nga natin, antibiotic resistance, no? So a lot of studies have shown that resistant na dun sa amoxicillin, no? A lot of studies. Kaya yung mga doctors, they don't prescribe it anymore, no? So they want to prescribe yung mga higher form of medicine.
Opo.
Kaya,
Kasi one time nga nung sa isang doktor sabi niya, ay wala na yan, obsolete na yan. Sabi niya, yung doktor na yun, kaya tinatanong ko doktor kasi yung
but it's still in the market. It's still in the market, no? Yes. Kaya ang gawain ng mga doctor, the usual things that the doctors do is that they look at the information given to them. Sabihin ng information given to them by the medical world. Ito mataas na yung resistance to amoxicillin. Kaya yung may mga bagong drugs pumapasok, they will always say, oh, ito nang gamitin natin, ito nang gamitin ninyo kasi mahina na yung isa. No? So tendency for the doctors to prescribe the newer one, the more expensive one. The newer one, usually more expensive ones. May marketing din yan, di ba? May marketing, gano'n. No? Okay. So yung mga doctors, they don't think that, kumisan pwede pa naman, di ba? Pwede pa naman, especially kung mild infection lang, no? That you can still try it, no? And then observe mo for 3 days. Kung walang palitan mo na lang, di ba? Kaysa you jump into a prescription of yung mahal na gamot, no? Okay.
Thank you, doctor.
Nowadays, ang tendency for most of the doctors, they prescribe the more and most expensive antibiotics, no? Okay. So just as a lay person, sabihin, okay na sa akin na, basta umigi. Pero pagdating sa cost, mas talaga malaking diferensya, no? Okay.
Opo. Mura kasi yung
At times, pwede pa naman. At times, pwede pa yung mga mas mura. Amoxicillin, cloxacillin, no? Yung mga ganon.
thank you, doctor.
Any more? So there's a question here, Jocelyn T. You need the doctor's prescription to buy antiviral drugs? Yes. No? Okay. Antibiotics, you need prescription. Antiviral drugs, you also need prescriptions. No? Okay.
Thank you.
Okay. Okay. So it's already 3:11. Last call for any question. Kung meron pa, pahabol. Wala na.
Wala na, doctor. Thank you.
So
Thank you, Doc.
let's call it a day, and then the topic next week will be analgesics, mga gamot, yung mga common drugs that you will use in daily life. No? I will talk about analgesics. No? Okay, marami yan, malaking coverage din analgesics, mga painkiller. Okay?
Thank you, Doc.
Thank
you, Doc. Thank you.
Bye-bye.
Bye-bye.
Bye.
Thank you, doctor.
You're welcome.
Thank you.
Okay.
Thank you, Doc.
Bye-bye.
Doc,
Thank you.
yun yung refer, natawagan na po ba kayo?
Usap tayo mamaya.
Sige po.
Okay. Bye-bye.
Bye.